Welcome. Thank you for watching this dairy video brought to you by DAIREXNET. In this video, Dr. Ernest Hovingh joins us to discuss lameness prevention with a focus on footbaths. If you'd like alerts on new articles, videos, and resources, be sure to check out the video description below to follow us on Facebook and Twitter or sign up for our newsletter. And don't forget to subscribe to our channel here on YouTube. Today's presenter, Ernest Hovingh, earned his veterinary degree from the Ontario Veterinary College in Canada and was in mixed animal practice for a few years, during which time he looked after the health of various livestock and pet animal species. He then completed a food animal clinical residency and PhD program at the Atlantic Veterinary College on Prince Edward Island. He then migrated south to be a faculty member at the Virginia-Maryland Regional College of Veterinary Medicine. Since 2004, he has been an extension veterinarian, applied researcher, and field investigator in the Department of Veterinary and Biomedical Sciences at Penn State University. His extension and research interests include many areas of cattle health and productivity, but especially hoof health, mastitis, Johne's disease, cow comfort, and animal welfare.
All right, and welcome to the Preventing Lameness in Dairy Cattle webinar. I'm Ernest Hovingh. I'm an extension and research veterinarian here at Penn State, and I've been working on lameness in dairy cattle for many years. And preventing lameness is a very important topic in the industry these days. Lameness is a very common problem. It's an animal welfare issue. It's a very important economic issue, and so it's something that we need to deal with. And prevention is the best way to deal with lameness. We certainly want to try and prevent as many cases as we can. But I have this slide up here just to remind you that we also need to make sure that we identify any cases that we are not able to prevent. So even in our best programs, prevention programs, we're going to have some lameness in our herds, and we need to identify those animals that become lame as quickly as we can, and then we need to know how to manage them so that we return them to health. And through that process of identifying and managing lame cows, hopefully we can learn something about how to prevent the next case. So just as a complete picture for your herd, prevent, identify, and manage lameness, and have a program for each of these. So if we're going to prevent lameness, it's certainly important to understand a little bit about what causes lameness in our cows. So if we understand a little bit about why lameness occurs, then we can understand ways to prevent it, and we might find some ways to prevent it that I haven't discussed today. One of the ways that we can break down some of the causes of lameness in herds is to think of them as infectious causes of lameness and non-infectious or mechanical causes of lameness. Now, these certainly aren't completely mutually exclusive. There certainly can be some overlap in these, but it's fairly helpful to think about them in these categories, that some of the lameness problems that we observe are due to infectious organisms, and some of them are due to mechanical factors or non-infectious reasons. So we're going to look at both of these, and we're going to look at a few ways to prevent infectious lameness, and we're going to look at a few ways that we can try to prevent non-infectious lamenesses from occurring as well. So again, understanding lameness, it's important to think about where lameness occurs, and that can help us understand a little bit about why it happens and how to prevent it. Certainly if you look at records and if you look at research that's out there, the vast majority of lameness that happens in dairy cattle happens in the feet. So there's very little lameness that occurs in the legs and in the hips. There's a little bit, but it's relatively unimportant in the grand scheme of things. So we're going to be speaking about lameness that occurs in the feet. It's interesting, if you look at, again, how that is broken out in the feet, you'll find that most of the lameness that occurs in the feet occurs in the outside claw of the hind feet. So part of the, one of the webinars in this series had to do with nutrition and lameness, and that certainly is an important factor when we talk about healthy feet, is to have a good nutritional program. But the nutrition is obviously going to affect all the claws in all the feet, and so it is certainly not the only factor that is important when we're talking about lameness, because then we would expect to see the same amount of lameness in all of the claws of all of the feet. So there must be some other factors that affect lameness and the occurrence of lameness in the outside claw of the hind feet. So we'll look at a few of those, and we can think about why that might happen. So when we're talking about infectious conditions, it's primarily a bacterial infection that we're talking about. It's still not completely clear. There's both foot rot and digital dermatitis that I'll speak about. There's different bacteria involved in those lameness conditions, but they are bacteria. We haven't completely identified which bacteria are involved. Foot rot is fairly well known, but digital dermatitis not nearly as well. And it's a complicated factor because simply the presence of the bacteria is usually not enough to cause the lameness problem. So there are other risk factors that are also important, even though the bacteria may or may not be present. When we're speaking about non-infectious lameness, we're thinking about poor quality hoof tissues. And so that can be either the sole of the foot, the hoof wall, the white line, or the heels. And when we have poor quality tissue, we end up having an increased risk of mechanical breakdown of the feet. And that can be very problematic for the cow. If her feet break down underneath her, then we end up with a situation where we have painful conditions, and that can lead to then lameness and decreased milk production and other animal welfare and production concerns. So if we start by looking at some of the infectious lameness conditions, as I already mentioned, digital dermatitis, which is also called hairy heel warts or strawberry foot or Mortellera's disease, that's certainly one of the most common things that we see out there in our dairy herds today in the States and in many countries around the world. Dr. Van Meter will be dealing with this condition in more detail in another webinar, especially as it comes down to identifying individual cases. So here we see a wart, one of the stages of a digital dermatitis infection. And he'll be dealing with that more in that webinar in terms of how to identify that in individual animals and how to manage that, because that is a very important part of that condition, is to manage individual animals that are infected. But we'll be talking a little bit about how to prevent the condition in this webinar. Foot rot is another condition that occurs. Again, it is a bacterial infection, and what we tend to see with foot rot is that we have a swelling in between the heels here. So we'll see cracking or rough skin between the claws, and then we see inflammation or swelling here in between the heels of the foot. And so those cows can be pretty lame, and foot rot can certainly be a problem. We don't see it in general as frequently as we see digital dermatitis. But again, both are infectious conditions, and we're going to try and prevent those in fairly similar ways. So if we look at some of the risk factors for infectious lameness conditions, when we, especially talking about digital dermatitis, the introduction of infected animals or contaminated equipment is certainly one of the big factors that's going to spread this from herd to herd. If you look at the data that's out there, it suggests that a large percentage of the herds in North America are infected with this condition already. But if you don't have digital dermatitis in your herd, you should be very careful to try and prevent that from being introduced. Some of the other factors that are a concern is having wet or dirty feet. That puts an animal at increased risk for digital dermatitis and or foot rot. And again, damaged or irritated skin can also be part of those risk factors. So how are we going to prevent this? If we know those are some of the common risk factors, we can look at prevention. So biosecurity is one of the things we want to think about. If whether or not we have digital dermatitis in our herd, we should think about not bringing any more in, whether it's slightly different organisms or different strains of the organism. And so when our hoof trimmer comes in, we should have a clean chute or a clean table, clean equipment. And in many herds, we even have them wear a pair of gloves that stay on that farm and are not brought from one farm to another. So biosecurity, even if you have digital dermatitis or foot rot, is something that should be given serious consideration. And a lot of hoof trimmers are doing a good job in terms of washing down their chutes, putting their hoof knives in a disinfectant solution, and again, using gloves that are specific to that herd, or using a new pair of gloves at every visit. The other risk factors, if the feet are dirty and wet, and so keeping our feet dry, clean, and healthy is also very important. So nutrition plays a role in keeping the feet healthy. If we have healthy heels, then those animals are less likely to become infected with digital dermatitis or foot rot. If we have feet that are also dry and clean, that will also reduce the risk for infectious lameness conditions. So here's one herd that is on a rotary parlor, and again, a lot of these feet were very clean, and again, that's the way that we like to see those feet. Foot baths are also part of our prevention program for these conditions. They tend not to be a very good way to treat active lesions. It just doesn't work that well, but it does work pretty well as part of the preventive program. And so we need to use foot baths and use them properly in order to reduce the risk of spreading the infection from one animal to another or from the environment to the animal. So foot baths are a pretty critical part of our prevention programs for infectious lameness conditions. So we'll look at a few things in a little bit more detail about foot baths. Over the last number of years, there's been some efforts to try and improve the design and the dimensions of foot baths to increase their effectiveness. There's been relatively little research looking at whether or not this has significantly improved their performance, but it makes sense just looking at how the animals move through them. So some of the new dimensions that are out there that are recommended is that we have these foot baths about 10 to 12 feet long. A lot of the older foot baths tended to be in the 6 to 8 foot length, and now we're suggesting that they're a little bit longer so that we have more opportunity for those feet to get dunked 2 or 3 times in the Footbath solution. Of course, if we use the same width on our foot baths, which is typically 4 feet for the older designs, then we're going to have to use a lot more product, and we can't get 2 cows through there at one time anyway. So now we're recommending, again, a narrower foot bath. Cows seem to move through them quite well, even at about 2 feet wide. It seems to work pretty well. And so we can reduce the amount of solution we need to use if we use an approximately 2 foot width on the foot bath. We'd like to see the solution in there deep enough to cover the heels of those cows pretty well, but we don't need it excessively deep. Once again, if we get too deep on the foot bath solution, we end up using an excess amount of it. Plus, there's the potential, if we end up with a very deep foot bath solution, that we might end up splashing some of that solution onto the udders. So it's generally recommended that we try and keep it at 4 to 6 inch range. Again, it depends on whether or not the foot bath is in a level location, and I'll show you a picture of that in just a moment. One of the things we can do to try and slow the cows down going through the foot bath just a little bit so that they're not running through the foot bath is to increase the step-in height over the solution height so that we have a total step-in height of approximately 10 inches. So it's about twice as high as the depth of the solution. And this gives that cow a second to pause as she's walking into that bath, and is going to generally make for a smoother passage through the bath rather than have her try to run through that. So those are what we generally recommend. Here's one of the installations that I was in fairly recently in Pennsylvania, where they had installed a foot bath according to these dimensions. So you'll see here we have a step-in height. It's approximately 10 inches high. Our foot bath solution, we'll talk about that a little bit more in a few minutes, but it's a number of inches below the step-in curb here. You'll see that we're just a little bit over 2 feet wide here with a sloped side here. And then one of the other things we have is a movable gate on this side that we can open if necessary. Again, I didn't measure this one, but we're, I believe, close to 10 feet, slightly over 10 feet on this foot bath. So if we look at the picture, and again, thanks to Hordes for this picture, but here's the schematic of that, what it would look like. So we're going to have 20 to 24 inches wide, a 10 inch or so step-in height, 4 to 6 inches here, and then a 10 to 12 foot long bath for that cow to walk through. So although this is what we're considering a more ideal foot bath nowadays, there's a lot of herds that don't have this, and given what milk prices are doing, we might not have the money to put that in. So there are ways that we can work with our existing foot baths to try and improve their performance. One of the things we can do is to try and divert the cows around the foot bath when it's not being used. So in this situation, there's a gate that comes across here, and these cows travel down the outside of this alleyway here when these foot baths are not in use, when there's no medication in them. So it's one of the things that we can do to try and prevent the cows from walking through a manure-filled bath. If we are going to walk our cows through our foot bath, if we don't have a way to divert them around there, then it's a good idea to put water in here with a little bit of dish detergent or other soap in there that will help clean the feet. Again, we want to try to not make these into manure baths that are actually going to potentially increase the risk of spreading infectious lameness conditions or infectious bacteria from one cow to another. So these are some of the things that we can do. Again, in this situation, we would probably recommend putting treatment in both of these baths if we're using a bath like this, rather than using a plain water bath here and then a treatment bath here. We're better off to put a treatment solution in both of these baths, because this one here at the back, if it's just water, will soon become filled with manure, and then we end up potentially increasing the risk of exposing those cows to infectious bacteria. So some of the older movable foot baths, they have the advantage that we can move them out of the alleyway when they're not being used. They tend to be short. These tend to be 4 feet by 6 feet long. And so a single bath is going to, if we're just using a 4 foot by 6 foot bath, we're going to tend to have less dunks per cow pretty significantly. And in some cases, they might even try and squeeze by the side of these. So there are ways that we can use these baths and some strategies to try and improve that. You'll see here we actually have a series of baths right in front of each other. And we've got 1, 2, 3 baths here. That might actually be a little bit excessive. But again, we're increasing the chance of getting multiple immersions of each foot in this foot bath and increase the value of that foot bath solution. So there are ways that we can work with the existing foot baths that we have to increase their performance. So I get quite a few people that ask me, what should I put in the foot bath? And that's a common, what's the best thing to put in a foot bath? And my answer to that always is, the best thing to put in a foot bath is a clean foot. So we can argue about which solution might be the best, but if you put clean feet into a foot bath, suddenly you find that a lot of solutions seem to work a lot better than when you're putting very dirty feet into a foot bath. So in this picture here, you can see that we're getting these feet well covered. We're probably at the 6 to 6+ inch range on these on the depth of this solution, so we have these feet very well covered. But you can see that these legs are very clean. The feet are clean. If you look at the top of this picture, you'll actually see a very clean foot here. And the other thing you'll observe is that the walking surfaces here are also very clean and dry. So these are ideal conditions to optimize the foot bath solution. The opportunity for it to work is if we have clean feet, clean environment, and then maintain a clean foot bath solution. So even though it's a little bit of a facetious thing to say that we have clean feet, I think it is very important. And one of the things I've had some dairy producers do, again, I don't have research to back this up, but they will actually spray the feet in the parlor before the cows go out and through the foot bath. And they report that it appears that their foot bath stays cleaner and that it seems to work better than if they have dirty feet going through there. So that might be something to consider, is to at least spray off the hind feet of the cows as they're in the parlor before you release them to go through the foot bath in the exit alley. So when we actually talk about what solution should you use in the foot bath, there's relatively little research that's been done to validate this. It's difficult to do this research, and it just hasn't been done that much. So what we commonly see as solutions that are being used is a formaldehyde solution at about 5%, and that does present some potential worker concerns that we need to be mindful of. Copper sulfate is a very commonly used product, and that's usually used at the 5 to 10% range. There are some concerns about soil loading of copper if we're using copper sulfate in our foot baths. And so one of the things we've seen over the last number of years to try and reduce the amount of copper that we actually need to put in the foot bath is that we use an acidified foot bath with copper in it to try and reduce the concentration of the copper, which is more available once we acidify the solution. So if you have an acidified copper sulfate foot bath, you could probably be in the 3% range maybe a little bit more, but that will tend to be as effective as the 10% at a normal pH. The one thing we need to be concerned about is as we're acidifying these foot baths, we might actually be causing some damage to the skin of the feet. And so I usually recommend that we're at about the 4 pH, maybe down to 3.5, but I really don't want to see it go much below 3.5, or we run the risk that we're actually making the skin worse and potentially increasing the risk of infections as we're damaging that skin. So I'd really like to stay in that 4 down maybe to 3.5% range. And that's pretty simple for producers to check. And again, something I think should be done on a regular basis is to make sure that Footbath solution is at the proper pH. So speaking of checking Footbath solution pH, we need to make sure that the solution is actually mixed up properly. And that's going to involve some employee training and protocol compliance. We need to make sure we don't have communication issues, that the employees understand not only how to do it, how to mix it up properly, but how important it is to mix that solution up properly. So a little bit more or a little bit less is not something that's acceptable. And again, the employees need to understand the important role that they play in that. There was an interesting study a number of years ago that looked at this. These were smaller herds that used formaldehyde, a diluted formaldehyde solution. And so they measured the concentration of formalin in the foot baths. And these producers all said that they knew the correct way to mix them up, but the initial concentration was was inadequate in 56% of the herds that they sampled. So if you don't even mix it up properly to start with, then we can expect a higher rate of failure in those foot baths. And these herds were small enough that they could leave some of the they could leave the foot bath there for the second milking. The foot baths tended to stay full, but by the second milking, only 89% of the herds. 89% of the herds did have an inadequate concentration, so 11% only had an adequate concentration of formalin at that point. So that's an extremely important factor to remember as well, that it needs to be mixed up and monitored properly. Another thing I get asked is, how often should I be using a foot bath? And that I can't give a blanket answer to. That's going to vary from herd to herd and even from season to season. A lot of the other risk factors that we talked about are important in determining this. So if we have very dirty feet going through a foot bath, I find that some herds are foot bathing 7 days a week or 5 days a week, maybe 2 milkings a day, and find other herds that have very clean feet in a dry environment are maybe foot bathing twice a week or 3 times a week. So again, I can't give a blanket recommendation for this, and it really has to be done to effect. The other important consideration here is that we have a good program to treat individual cows that have active lesions, and that's something that Dr. Van Meter will be talking about in another webinar. But if we're managing our individual cows well with topical application and or perhaps short-term wraps, we can usually be foot bathing less. If we're not doing a very good job managing our individually infected cows and we have dirty feet, then we're going to be seeing that we need to foot bathe 7 days a week, perhaps twice a day. The other part of this is that we need to replace that solution as it's needed. I showed you that one picture earlier of the nice blue coloration of the foot bath, and that foot bath stayed that color throughout the whole milking. It was replaced as needed. Here's another situation where we might have a very well-designed foot bath, but we have a manure slurry in there instead of an effective solution. And so in this case, even though we have a well-designed foot bath, we probably aren't getting the effect that we would like. So usually we say somewhere in the 200 cow passes per foot bath before we change it, but that's again going to vary with how clean the feet are, how well the cows move through there, if they're likely to be defecating in there. In some cases, we might have to be replacing it more frequently, and in some cases, we might be able to get 300 or 350 cows to go through there. So speaking of having cows move through the foot bath, one of the things we don't want to have is the cow lingering in the foot bath because they are likely to defecate in there. At the same time, we don't want them running through there. So we want to have the cow pushers move those cows calmly but effectively through the foot bath so that they're not standing in there and defecating. Another group of animals that we want to think about on the farm for footbaths is our dry cows and heifers. Footbaths can play an important role in trying to reduce infectious lameness conditions here as well. In heifers, if it's needed and it can be done properly, I think it's very important. In some herds, we do have problems with heifers getting digital dermatitis and or foot rot, but in some other herds, our heifers really don't seem to have a significant infection level. Now, it is true that if those heifers come in infected, they have a very good chance of maintaining that infection for a long time afterwards. And so if we do see infectious lameness conditions in our heifers, especially digital dermatitis, we want to try and set up some way to foot bathe those heifers before they enter the lactating cow herd. Same is true with our dry cows, but in most herds, our dry cows are likely to have some level of infectious digital dermatitis, and so we'd prefer to see if we can have some way to foot bathe the dry cows on a fairly regular basis. I said here, if it can be done properly, what we don't want to do is dump a few portable foot baths in there and leave them in there for a week without changing the solution, because then we end up again with a manure bath and we end up increasing the risk of infectious lameness conditions rather than reducing it. So if you're designing new facilities, we would want to consider how we might be able to put foot baths in the crossovers or some other way that we can run those dry cows and those heifers through the foot baths on a regular basis. And if we're going to do it, we want to make sure that we change that solution as it gets dirty so that we don't end up increasing the risk of spreading infectious bacteria. All right, so let's spend a few minutes now looking at non-infectious lameness conditions. As I explained, these are conditions where we get a breakdown of the sole or the white line or the hoof wall or other parts of the hoof. So here's a cross section of a foot. You can see the P3 bone. This white line here is the P3 bone that comes around this way in the back. This is the sole of the foot here. And this is actually an ulcer that we have in this foot. And you can see there's a breakdown here of the sole where there's a defect or a hole all the way through the sole. And this tissue here is exposed. The soft tissue here is exposed through this opening in the sole. So that's a sole ulcer that we can see. Here's another one where we have a block on the opposite claw and we had a white line infection. And so this white line infection has been opened up by removing the hoof wall. And you can see that we're now back to fairly healthy looking tissue here, but that infection had spread quite a ways underneath that, through that white line underneath the hoof wall. So the tissue that we see here, this red tissue here, is the corium, and we really need to protect that corium because that corium is what produces all of the structures of that foot. So we can look here at a cross section of a foot that is not diseased, and the corium runs all the way around here. So this red line is where we would see the corium. There's different zones of the corium. We won't talk about those now, but the sole, for example, down here is produced by this part of the corium, this red line right here, which is just above the sole material that we see. So this corium is extremely important, and if we injure the corium or compromise the corium, we're likely to end up with breakdown of the sole or the hoof wall or the white line or the heels back here. So protecting the corium is what we're talking about. One of the things that we need to be concerned about is the amount of force or weight that we have on the corium, because that can compromise the health of the corium. So these are some calculations done by a colleague, Dan McFarland, and he'll be presenting another webinar in this series on housing and cow comfort. But if we look at a 1,400-pound cow, and we assume she's got just about 8, not quite 8 square inches per foot underneath her, if she's standing, she's got about 45 pounds per square inch of force on that corium. If she's walking, so that she has one front leg and one rear leg up in the air, she's about at 90 pounds per square inch, again assuming a 50-50 distribution, even though this isn't completely correct, but still just for these purposes, for illustration, she'd have about 90 pounds per square inch, and that's again assuming we have that 8 inches, almost 8 inches per square foot. But if you look at these images, this image here, you can see we end up often with significantly less than 100% of that 8 square inches having weight on it. So if we're more at the 60% bearing, then we're up into the 150 pounds or so per square inch on the corium. Now, if you want to be able to relate that to something, if you take your thumb and you put it on a concrete surface, it's about 1/3 of a square inch. And so if you take 2 concrete blocks, 8-inch concrete blocks, and balance them carefully on your thumb, you've got some idea approximately the pressure or the force that's on the corium of the cow. And now obviously she was designed for that, so she can handle a fairly high pressure, but if we're walking her through especially a concrete environment, we're going to end up with even more than this 150 pounds per square inch. Because what we typically see, and this was from a publication in Journal of Dairy Science a number of years ago, that even a cow that has her feet trimmed flat does not end up with an even weight bearing across the whole bottom of that sole. So you can see in this where they had these cows standing still, weight bearing on all four limbs on a flat surface, completely flat surface. This area at the back of the outside claw here still has about 5 times the pressure on it than these light blue areas here in the other parts of the sole. So we don't have an even weight distribution, and this red area is going to be significantly more than 150 pounds per square inch, and so we're going to have a tremendous amount of weight, pressure on the corium. Now you take a foot like that, instead of standing on a nice flat surface, and you put her on an uneven surface such as this, you can see that suddenly we would lose probably half of the weight-bearing surface here, so we would not have any weight bearing in this area, we would not have any weight bearing in this area, there would be no weight bearing up in this toe, and suddenly we're going to increase the amount of force in this area significantly more. And so again, you can appreciate that there's a tremendous amount of force on small parts of the corium, which is detrimental to the health of that corium. So how are we going to do that? Well, we're going to protect that corium, and how are we going to do that? Well, some of it is through the digital cushion. We'll spend a few minutes looking at that. Some of it is how we're going to trim that cow and how thick of a sole we have underneath that cow. And then we need to look at the walking surfaces and cow comfort. So here's an image of the digital cushion. I know that Dr. Van Son talked about this in the webinar on nutrition, but just to illustrate this through a picture of the cross-section of this foot, again, this is the P3 bone right here, this white structure here. This is the corium running right along the top of the sole here, this reddish purplish tissue. And you can appreciate that we have a very nice digital cushion right here. If we look at that a little bit closer, you'll see that that digital cushion actually wraps around the back of this foot here, on the back of this P3 bone. And you can see that this P3 bone is separated from that corium by a rather significant distance. All right, so we've got essentially a shock absorber here that's going to try and spread out the pressure from this P3 bone across a larger area of this corium rather than having it concentrated in one single area. So here's another cow, another cross section, and in this case what you can see is that we have no digital cushion here, essentially no digital cushion. There's no fat left in that digital cushion, and now we have an extremely small distance between this corium and this P3 bone. So there's going to be a lot greater chance of damaging that corium when we have this P3 bone pressing down directly on the corium. So we want to try and maintain the body condition, as Dr. Van Son has talked about, trying to keep that digital cushion as thick as we can to decrease the risk to the corium. One of the other things we want to consider is the thickness of the sole and also how flat that sole is. So Dan McFarland will be talking about grooving floors. As we groove floors, we take away weight-bearing area. And you can see through this cross-section, again, we have significant parts of the bottom of this foot which are not going to bear any weight. So there's be some on the hoof wall here, but there's no weight being borne through the sole here. There's a little bit through the sole right here and a little bit through the sole right here. And because we also have a fairly long toe on this cow, we have most of our weight focused on the back of this P3 bone here, which again does have a pretty healthy digital cushion, but we're going to end up with pretty significant force being applied to the corium in this area and in this area right here, and very little in the toes in this situation. So what we want to try and do is through our trimming and through maintaining our housing, we're going to try and keep this sole as thick as we can at the back. Okay, we want that to be a 1/4 inch thick, and we want to trim this so that we don't have as long a toe on this cow. And so after we trim this cow, this is what it would look like. So it's the same foot. It's been trimmed, and again, we don't have time to get into all the trimming details here in this webinar, but it's been trimmed according to the recommendations that we have for trimming. So about 3 1/4 inches long on the front hoof wall, a 1/4 inch thick here at the toe, we really didn't take anything off of this heel. And so now we have a fairly evenly thick sole across the bottom of this foot. And you can see that we have more even weight bearing across the whole bottom of this sole. And so that's going to take the force off of this corium in this area right here and spread it a little bit more evenly across this corium and reduce the risk of injury back in this area, in the B area back here. So this is what we're trying to achieve with our trimming techniques, to try and get a flat sole to increase the weight bearing area. And we want to try and have a normal angle here so that we have a normally thick sole at the front, at the toe, as well as at the heel. So in most cases when we're trimming, we don't need to take anything off of the heels because they tend to wear fairly quickly. So when we do that, and this was done in this study as well, they trimmed it according to this technique to try and get it as flat as possible. This is actually after the trimming, and you can see that we do have some increased weight-bearing area where we didn't have that before. So we do have some increased weight-bearing area here. You can see on the medial claw or the inside claw, we still have an area where we're not having any significant amount of weight bearing, which is somewhat similar to what we saw right here. And we've got a little bit more at the toe. But in general, we're trying to increase the weight-bearing area on the bottom of these feet through this trimming technique. You'll still see that we have significantly more weight-bearing area here at the back of this outside claw. So obviously a cow has to interact with her flooring and lying surfaces a lot of hours per day, and she spends a lot of that time resting. Dan McFarland's going to talk about that. She spends a lot of time standing or walking on the floors. And again, Dan will be spending most of his time talking about those important factors, because there are a lot of those that are important in terms of maintaining healthy feet. So here are some of the ones, and I don't have time to get into these today, and this will be our engineers' talks, but we want to get those cows into the stalls so they can lay down, take their weight off their feet. We need to design the stalls properly and maintain the stalls properly. I'm going to spend just a couple of seconds not looking at the flooring, even though it certainly is interesting, but I'm just going to spend a little bit of time on this last one here about how we move our cows through the housing environment, when we're moving them to the parlor, and when we're moving them back from the parlor, because that can also be very important in a way that the cow interacts with her environment. So if we think about this, when the cow is moving, okay, so she's walking, what she should do is plant this foot firmly on the floor. She shouldn't move it, move her foot relative to the floor, and she should just roll through that stride without any movement. But what we see happening is that if these cows are being moved too fast, or if the floor is too slippery, then we end up with some motion in this direction. So if she's moving forward, she'll tend to put that foot down and slide forward a little bit on it. Or another thing that can happen is that she can actually put the weight on that foot and then pivot on the foot while she has weight on it. Again, those are not normal motions for a cow, and those tend to be rather destructive to the bottom of the foot. I'll just show you a couple of quick examples of what happens. This is what we tend to see if those cows are sliding on the floor, especially if we have sand-bedded stalls. This heel back here is not protected by the hoof wall. The sole back here is not protected nearly as well by the hoof wall as the sole here is protected by this hoof wall. As I already indicated, there's also more weight on the back of the foot here, and so we tend to see that you're going to wear these soles pretty thin at the back, typically for cows in most of our housing environments when they're living on concrete. So at least some of this is due to them sliding in the floor or on the floor when they're moving. The other thing that we see is when a cow puts her foot down and pivots on that foot, we tend to see problems in this zone 3 area right here. And the reason is that we have the hoof wall and the white line and the sole. The hoof wall is kind of ending here, and so we end up with 3 different tissues that tend to tear apart as that cow pivots on that foot. So typically what you'll see in the zone 3 lesion locations here is that we end up with a white line infection. Okay, so we end up with some disruption of that white line as that cow turns her foot, and then we end up with that infection tracking up in that white line, and they might even break open up here at the coronary band, but that infection gets in at the white line. And so now we have a mechanical breakdown of this foot that leads to an infection, which leads to a very lame cow and a very sore cow. So those are some of the ways that we move our cows can affect what happens in their feet. All right, so we certainly didn't cover all of the ways that we're going to prevent lameness, but prevention is certainly the best investment of time and resources when it comes to dealing with lameness. We really need to try and prevent new cases whenever we can. It's not only in the best interest of the cow, but also in the best interest of production and economics. If we're going to focus our prevention efforts, they're slightly different for infectious and non-infectious lameness conditions. For our infectious conditions, we're especially thinking of biosecurity. We're thinking of dry, clean, and healthy feet, and we're thinking of how we can strategically use our foot baths to try and prevent new infections. When it comes to non-infectious lameness conditions, we really need to think about protecting that corium, and we can do that by maintaining a good digital cushion. We can do that by maintaining the sole thickness at the correct thickness, and also trying to get as much weight-bearing area on the bottom of that foot as possible. And then we need to think about how our flooring and our cow comfort are also going to impact the health of our feet. Thank you very much for participating. If you would like to contact me, my contact information, email address is in the first slide, and I would certainly be happy to address any questions that you might have.